Good evening, everyone. We welcome you all to ACME, Altia's Continuous Medical Education Program, as we observe World Mental Health Day on 10th October 2025 serves as a powerful reminder that mental health is not privilege but a priority. The theme of this year emphasizes the need to create awareness, reduce stigma, and encourage open conversation about emotional well-being because every mind matters. In line with this, Altius is organized this Facebook Live program. It is our great pleasure to introduce our esteemed speaker, Dr. Anirban Dutta, renowned psychiatrist practicing at Kalyani AIMS. Sir has a rich experience of over 10 years. So today's topic is mental health awareness. So let us all hear from Sir. Over to you, sir.
Thank you. I'm Dr. Anirban. So today we are going to discuss about mental health awareness. What is mental health? Mental health is a state of mind, and it's as important as our physical health. So I often get in the OPD when patient comes and says that, "Sir, let's find some another scan or another MRI and another investigation to see if there is some physical health that they can find, but they never stress on mental health. Even when they are coming to Department of Psychiatry, the only thing that goes in their mind is whether they have some fever or they have some other physical illness. Although, as I can talk to them and see, they are sufficiently stressed, significantly stressed in their family life, in their work, in their workplace, and other aspects. But still, the focus always seems to be the physical health. Now, why that is important? The problem is that whenever someone talks about mental health, or we as psychiatric practitioners try to discuss about mental health to patients, there is a certain stigma and barrier that prevents us to reach them. People always think that mental health is something that is always granted. If you are a strong person, if you are a person who has no weakness, then you are not supposed to suffer from mental health. It is not a disease, it's just a weakness. So that is a common perception that everyone has. And that's the main reason of this stigma. People always come to forward and proudly say that I have this physical illness like diabetes, hypertension, and that's why I am not able to do this tasks. Doctors has given us medicines, and then we are going to take it. But it's unlikely that any person has come out and reported that I have depression or I have anxiety issues or my relative or my people or my family member is suffering from any psychiatric disorder, and that's why we have come for treatment. It's always a taboo coming to a psychiatric department or speaking about psychiatric illness. The reason is that people think that psychiatric illness are a weakness, but it's not. Psychiatric illness are like any other physical illness. Any other physical illness results from changes in the body, changes in chemicals in the body, just like psychiatric illness. They are resulting in changes in chemicals in the mind. We have chemicals called neurotransmitters that change in the brain, and that's why psychiatric illnesses happen. It's just a disease like fever, like infection, like diabetes, and hence they need treatment, they need care. It's nothing to be ashamed of when you have a mental illness, and the only way to deal with mental illness is to seek help, come for help, and get treated from practitioners by means of medicine and therapy. Now, what are mental illness? Some of the common mental illness that we see are depression, anxiety, stress, then OCD. These are some of the common mental illnesses which are very prevalent in our population. There are some are also addiction, which is also considered under mental illness, like addiction of cigarettes, alcohol, and other drugs. Besides that, there are some severe mental illness which are found in less population, but they are also very severe, and sometimes they may impair the functionality to a great extent. For example, schizophrenia, bipolar illness, that of which mania is an important component. So these are some of the severe mental illness that require specialized care, like care in a tertiary center or hospitalization. So these are a bunch of psychiatric disorder that we commonly deal with. Now, how are you going to be aware that whether you or your nearby family member has any psychiatric illness or mental health issues? Number one is there are some signs that you can observe. If you yourself or your family members have, then it's suggesting that there is some sort of illness, psychiatric illness or mental health concern. So number one is having difficulty in interaction. The the thing that the first thing that changes, and that is the first complaint of most of the psychiatric, is a change in behavior of a person. Suppose your friend, your partner, your relative, his or her behavior is changing for a few days. Suppose the person is not talking to you or not talking to others, or sometimes talking 2 months, that is unreasonable. So these are some of the issues. The behavior towards other person has changed. The sleep is also an important issue, where there is excessive sleep or less sleep. Other issues like thought, changes in thought. Sometimes people feel that I am not worthy of doing anything, I might want to commit suicide, or I want to die. Or sometimes the reverse happens, that people have strange thoughts that comes to their mind, that they are being followed by people, or they are being trying to be attacked, or they can hear voices. These are such changes. So these are changes in thought and thought and hearing, that also present as some of the symptoms of psychiatric disorders. So changes in thoughts, changes in behavior towards others, changes in sleep and food habits. So these are some of the signs that we may notice, if we notice in our in our surrounding people. Some other signs like doing things repeatedly, which is abnormal. So it's very common, especially in people of West Bengal, that they are very fond of cleanliness. But sometimes this excessive cleanliness, or cleaning something repeatedly, or checking something repeatedly for long period of time, that is also a type of mental illness, that is known as OCD. So these are some of the things that some of the signs that we may need to be aware of, to see whether we are suffering from any mental health concern or not. Now, mental health illnesses or mental health concerns are generally managed in outpatient. Like, you come to a doctor, a psychiatrist, they will see you, they will assess what the condition is, and they will give you medication, or they will ask to take counseling, which is also a better word of counseling in terms of psychiatry, psychotherapy. But for time being, we can consider it to be counseling. So, counseling or medication, or by both, we would be able to solve this issue. So these are the most of the psychiatric illness which are common, can be resolved by this. But there are some psychiatric illnesses, some mental health concerns that may require hospitalization. Like in AIMS, we do admit patients in other hospitals, also in other government hospitals. As I worked in NIMHANS previously, there also we used to admit patients who are suffering from severe mental illness. For example, as I mentioned in the few minutes back, when people think that they are being followed, they are being talked about, they hear strange voices. All these are some of the concerns. All these are some of the concerns of mental health that requires hospitalization, because they may harm, or suicide, which is one of the very important thing. Every 2 or 3 days we get a call from the emergency team of some patient has committed suicide, tried committing suicide, attempting suicide, trying to hang themselves, or trying excessive dose of some other medications that has been given in order to commit suicide. So suicide is also a very important emergency in psychiatry, where we may need to admit the patient for a long period of time and see what is going wrong with the patient, why he has taken this drastic step of committing suicide, and all. So this is a basic model where this is, since this is a mental health awareness day. So what my intention is to spread a general awareness about what mental health illness is, and what are the concerns and how the disease present, because there is a lack of information in general population people, what is psychiatric illness, what are mental illness, and how they should go about in this case. So as I mentioned in the few back few minutes, that these are the signs or warning signs that you should look out for in your near and dear ones, in your relatives. And when once you find those in them, if you feel that they require help, you can always come and you can ask help from mental health professional, that may be psychiatrists. If you are not able to get psychiatrists, there are psychologists who can help give the immediate first aid, and if they feel they require medication, they can refer to the nearby psychiatric centers. So this is how disease should be treated, as you treat any other physical disease. As you go to a doctor, you take treatment regularly. So this is how all mental health illness should be treated, and that's why this day, and this is what I want to convey to everyone. Thank you, I guess.
A heartful thank you to Sir for sharing your time, knowledge, and perspective with us. Today, your contribution plays a vital role in helping out community recognize that Mental health is equally important and deserving of care and understanding. We deeply appreciate your participation and commitment to this program, sir. Thank you so much, sir.
Thank you. Thank you.